Radio Sultanate of Oman, 90.4 FM, and the Sultan Qaboos Center for Islamic Culture presents 2012 Season 3 of Reaching Out Through Dialogue, presented by Hatem Al-Abdissalam, hosting a group of intellectuals and experts from different fields. Don't miss the interesting discussions on science, comparative religion, culture, education, human behavior, and social issues. Reaching out through dialogue. Only in the holy month of Ramadan. Drugs in our lives. Did you know that drug rehabilitation programs often ask patients to declare a belief in God? How can belief in a power stronger than any man heal addiction and help us deal with unimaginable pain? Drugs can dull stress, tell our bodies to rest,
or wake and forget pain.
But it is only temporary.
How do we caution
our children about the dangers of drugs, alcohol, and other substances that will make them less sober
and awake to the world,
and their connection to Allah? We must communicate care and show the reasons for our words of advice.
Bismillahir Rahmanir Rahim. In the name of Allah, most gracious, most merciful. All praise be to Allah, the Master of the Day of Judgment, and peace and blessings be upon His Messenger, Muhammad sallallahu alaihi wasallam. O Allah, grant us knowledge, wisdom, and sincerity. Dear listeners, I'm your host, Hatem Al-Abdissalam. I salute you all with the salutation of the people of paradise. Assalamu alaikum wa rahmatullahi wa barakatuh. Please join me in welcoming my distinguished guest, Dr. Amira Abdul Muhsin Al-Raidan, psychiatry doctor and a member in the National Commission for Fighting Drugs, a chairperson at Al-Hayat Association for raising community drug awareness. Assalamu alaikum, Doctor.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
How are you today?
Alhamdulillah, fine.
It's nice to have you on the show for the first time.
Me too.
And I'm sure our audience will benefit very much from today's topic, as our topic today is drugs and narcotics in our lives.
Inshallah, we'll try to have a nice talk, inshallah.
Inshallah. Dr. Amira, when I called you for the first time and I told you about the show, and we chose this topic, drugs and narcotics in our lives, why do you think this topic is important?
Actually, it's a global problem, but it is noticeable now because of the awareness of the people now and of the advanced telecommunication between each other and the media. And as being a doctor at mental hospital, Ibn Sina Hospital, we came across so many cases, especially the background of abusing drugs and eventually ending up in mental problems like schizophrenia, depression, bipolar disorder. So really it is an alarming and alerting problem, and we have to tackle it wisely.
Now, to start off, so that we make our audience understand better, Dr. Amira, how can we define drugs and narcotics?
Drugs, simply in simple terms, it is analgesics, and it means the medicine prescribed by the doctor to relieve the pain. And narcotics, it comes from the Greek word narkos, and it means sleep. So narcotics are the drugs or medication that induce sleep, and so that it will relieve the pain. Among the categories of medication under narcotics are morphine and heroin, because it will modify your mood and also alter your behavior, and you will feel relaxed. So this is the term in
narcotics. Now, can painkillers prescribed by doctors be assumed or considered to be drugs as well?
Yeah, actually it depends on the use. If I want to make it very simple, if we take the sickle cell diseased patient, when they are having their crisis of having the pain in the joint and they want to relieve the pain, the usual medication used are the analgesics, the simple analgesics, which I mean, for example, the paracetamol or Profen. But if the pain is very severe, they will go to high-level class of analgesics, for example, morphine and tramadol. And these terms are usually known by the people in the community. So they will take these analgesics, the strong analgesics like morphine or tramadol or diazepam, and it will relieve their pain. With the time, with the frequent crisis, if they do have, and with the increase the dose of the analgesics, they will feel happy, and it will give them satisfaction. And so that they will feel they are relaxed and free of pain. If you stop the medication for them, they will feel something missing. And they are becoming addicted to simple analgesics, which are originally used for medical purpose. But now, if it's used in inappropriate dose or prescription by the doctor, it can cause addiction.
The addiction, is it mentally, doctor, or is it physically? The patient feels pain in the joints or in part of the body?
Actually, if we want to say the term addiction itself or drug addiction, it means a condition where the person become dependent on certain narcotic and that give him arousal of happiness and alter his mood and behavior. So the addiction, it is a level where the patient feel the desire to continue on use of certain analgesics, and therefore with time he become addicted. So this is what we are referring to becoming an addicted person. It is not only on physical level, but also psychological level. And therefore, the addicted person is not considered to be like, for example, he's playing around or malingerer. Actually, he's a victim. And therefore, in medical setting, we are referring to addicted drug use as being a chronic mental problem for the time being. It is no longer being as the patient his will to just play around and use the drug. He is really becoming dependent, and it is out of his control and becoming a victim of this problem.
Some would say that drug addiction is not severe in Oman and we're still on the safe side. Can you take us through this, Dr. Amira, and tell us, is drug addiction common in Oman?
Alhamdulillah, the problem, it's there. Regarding the case registry of the addicted cases in Ibn Sina from 2006 till 2011, and I thank the National Commission for providing the statistics regarding this matter, because everyone in the community would like to know how we are away from this problem.
What's the level of the number of people addicted in Oman?
Actually, the number is dramatically increasing among all age groups. But it is noticeable more in the age of 20s to 30s and being more in boys compared to the girls, because the boys are outgoing, unlike the girls who are staying at home. Another thing is that the rough estimation from 2006 till 2011 is 1,945 cases, according to the Ibn Sina case registry. But actually, we are just on the tip of the iceberg. What's hidden is more than this.
So this is the official cases that are registered with the Ibn Sina hospital, but there are many, many cases which are not referred or are not officially registered for some reasons.
Actually, the reason is very simple, is that, first of all, the people having the stigma about if they have a child or a daughter or a son, he's addicted, and it's not easy. Another thing is the taboo itself of the word addiction. Not to forget also the media, which also influence the problem. So it's not highly talking about. For example, we are talking about now in the radio, but really we need a lot of attention toward this problem. So this is why not so much cases coming to the hospital, because people, they feeling it's okay. The addiction, it's something simple. It will come and go. Another factor is that the person who is addicted to drugs, he's afraid. And he is feeling that if he go to the hospital seeking help, he will be reported to the police. And therefore, there is so much dropout cases, and which is not recorded in the system. And therefore, the figure is, in my opinion, it's not accurate. Because not everyone or not every case coming to the hospital, either it's far away There is no access to the service.
So they're not close to any medical center that can provide this service.
And the only service available as a mental hospital is Ibn Sina Hospital.
Now, for sure, there are some mistakes that communities do in terms of treating drug addicts. Maybe you can tell us a few things that the community can develop or change in terms of how to treat these drug addicts. For example, I would say people maybe don't know the difference between a drug addict and a drug dealer, and they associate that both these categories are the same.
You are right. First thing that the community level has to do is to recognize the problem. First of all, we have to admit there isn't a problem. Addiction, it's not an easy. It is a chronic mental problem that anyone can go through. And if the person started like exploring the drug, with time he will become using it. And with time he become abusing it. Using it in terms of exploring. But he will like it and he will be dependent and he will have the compulsion where he cannot stop. He have to repeat 1 and 2 times, 3 times and become abusing the drugs. With the time, he will look for alternative for the drug. If we'll take an example like morphine, it will not be enough. Okay, I will look for something else.
Which is stronger.
Okay, he will go for higher level, like for example, heroin. And it's not only enough. I will use strong analgesic tablet. So the tolerance, his ability to get the desired effect will not depend on one drug. He need to combine so many drugs. And the person, he will move from being a normal person to abusing person and to be addicted. With time, this addicted person, he will have a problem. He cannot provide them the drugs. He will go to different ways. So that he was a normal, he become addicted, he can go to become a dealer with time. And really, he's a victim at the end. And we have to highlight this issue that it is not a problem of the individual himself. So the person himself having issues, the family surrounding this person,
the
community. So if we say about what are the mistakes, first of all, we have to know there is a problem. And we have to have all...
To admit that there is a problem.
To admit there is a problem. Because people still, they feel we cannot talk about the drugs because it's something easy. The person will try it in life and he will just stop it. And it's difficult to stop, as I told you, because it is a chronic problem. It's not only one day problem.
Now, Dr. Amira, let us go step by step. And for sure, our audience would like to know, how can you identify a drug addict? What are the symptoms? So if you have, for example, if you have a child at home coming back from schools, what are the things that parents should look for to find out, whether their kid have gone to this line or not? Are they on the safe side? Are they, suspecting them to be drug addicts or not?
We can, for example, make it simple for the people to understand the symptoms. Like, for example, having 2 categories. The first one is the physical changes on the person himself or the child, and the behavioral changes. The physical changes that the person, first of all, he will be tired, he will be lazy, doesn't want to go to school, frequent escape from the school, or being late going to the school, forgetting while the class, not doing his homework.
So all these should be indications that something is wrong. Not necessarily, it might not be drug addiction, but this should be for a parent an alarming thing that you should find out, what's going on. And
this is what I'm talking this about, the behavioral changes, that he is not performing well at school. At the home level, he will be alone. He prefers to stay at home alone. Isolated. Not sleeping much, not eating much with the family. So they have to watch out what's going on. The walk of the child, they have to watch his gait. There is, we call it in medical term like physical instability walk. It means that he will be like unbalanced gait, unbalanced walk. So they have to watch out what's going on with this child. Other than this, in the behavioral changes, he will have new friends. He will get rid of the old good friends and he will search for new friends and he will hide it from his family. So they have to know who is this new friend. He's going out, frequent staying outside the home. Why? So this all alerting behavior changes. If we come to the physical changes, there will be sweating in his hand, red eyes, runny nose. The child will complain of abdominal pain, for example. Not necessarily a child, even a teenage. Abdominal pain, frequent vomiting, loose motion. This is all the physical changes.
The general symptoms.
Yeah, and also not to forget the blank stare.
The blank stare, okay, as if they daydreaming.
Like a daydreaming.
Okay.
He's not in concentration. He's not paying attention to what you are saying. This all physical signs and symptoms the family they have to watch out.
Any body marks, Dr. Amira, can be observed from a drug addict?
Actually, they have their tricks as being an addict. For example, they will try to hide the places where they do the injection. For example, if they are in advanced level of abusing drugs, like heroin or morphine. So the usual place is in the arms. But
that's the common place
in the arm and the forearm. But they are afraid from the marks, from the frequent use on the skin. So they will try to inject in the legs. Or in the groin area.
Where it's not visible.
Not visible. Or in severe cases with time, when the veins are faded, no longer able to have good blood flow, they will inject in the neck. And this is the risky place. So the family, they have to watch out for physical marks, as you said, and it will indicate this is a serious problem. The person is moved to advanced level of addiction.
Dr. Amira, we normally see in the media or in certain movies that there is always a drug addict will always have black eyes underneath their eyes. Is this something only for the movies, or is it really practically happening that it might be one of the symptoms?
Actually, it is a real symptom because they are tired, they are not sleeping. Yeah. The main thing that the addicts, after getting the treatment, if they will go for treatment, they will complain of poor sleep. They want more of narcotics, more of strong analgesics to help them to sleep. So the blackness, it's really because of tiredness, because not able to sleep.
Yes.
And this is another also physical sign the family, they have to watch for.
Dr. Amira, are there stages for drug addiction?
Actually, there is a simple way to describe the stages. First of all, is the stage one is to explore the field or
this new world.
The new world of addiction. So there is an exploration phase where the person have the curious to know about the drug and he will try to use it. The second stage, he will...
Before you go to the second stage, normally curiosity comes through friends, through, trying new things. Yeah. Sometimes people challenge you that you cannot use this, or you're not man enough to do this.
Exactly. So the behavior of the surrounding, like, for example, if you want to belong to a team, or to be a role model for a place, or to show that you are strong, you are masculine, you will follow the team.
Yes.
And therefore, as you said, the influence of the peer, it will have a strong impact
on you,
on going for the field of curiosity, just to explore this world of addiction.
Do most of the drug addicts know that they are getting into drugs when they are using it the first time, or is it just as a surprise?
Actually,
what are they thinking? If we can go into the mind of a drug addict, what were they thinking in the first place?
First of all, they feel it's just a trial and I will just use it one time and I want to explore like others what's going on with me.
Yes.
And he will have the happiness feeling and feeling relaxed. There is a simple term, we can call it euphoric state, where he feels happy, he's high. And this is the feeling that most of the teenagers, they want to experience all the time.
Yeah. So they when you come to teenagers, they always find their life is miserable. There's a lot of commands, orders from the parents.
Yes.
They are restricted. They can't do whatever they want. They can't go out with friends. So this might be a way to release
their stress.
Yeah, their stress or depression in somehow.
And the problem, they don't know that if they continue, it will cause a harm. So they will go to the stage 2, which is establish a relationship with the drug, where he will try to be dependent on the drug. use it regularly, using several times a day, and then with time, he will reach the stage 3 where he become dependent. Because if he stop, he will experience what we call withdrawal symptoms. That I told you earlier, the signs, tearing, red eyes, darkness under the eye, loose motion, vomiting, runny nose, flu-like symptoms, tiredness, all these symptoms that he is no longer likes to go through, but it's already done. It's already there.
When we are in stage 2, do you think that humans are always thinking that we are in control? And that, we can handle this?
Yeah, because I told you it will give you a state of euphoric state, which is, okay, I'm the man, I am the control, I am the power. So they will feel they control the situation, and they will feel, okay, I can do whatever I want and I can stop anytime.
Yes.
He will have this feeling, because this way he will continue with time, because he said, no, not today, I am controlling, I will do it tomorrow.
Yes.
And he will keep promising himself.
And tomorrow never comes.
Never comes, yeah, exactly.
Until
and he
you
will
move on to stage 3.
خلاص, he become dependent and he feels difficult to stop.
So the stage 3 would be the last stage in this process.
Actually, we call it...
Is there a worse stage then?
There is a stage where he become overdosed. Because after being dependent with the drug, he will try to stop from time to time. And he will fail, that person. And he will feel guilty, will feel depressed, he will feel worthless. His ability to control the situation is lost. So he want to forget. He will take more. And the cycle comes again. And the mistake that sometimes they come to the stage they are very depressed and the life doesn't worth. They want to end up their life. They can take an overdose of whatever available injection with the tablet, and they can reach a stage which is fatal stage called overdose, where the person loses his conscious, his lungs no longer able to accept the air because he's not conscious that, he's not aware about what's going on. His blood pressure, his vitals, everything changes in the body, drop down, and he will eventually die because of overdose.
Let us go to more details, Dr. Amira. We want this to be very educational to our listeners, and they should understand the severity of this topic and this, I call it disease. What are the common types of drugs in our society?
The common type of drugs used actually in our society is starting with a simple, available, cheap, non-smoking tobacco. We call it chewing tobacco.
Chewing tobacco. Okay.
Yeah, and it's called afdal in our simple
local language.
Afdal is available every place. There is no restriction about its presence and availability. Actually, it's available in most of the shops. And it's cheap. It's almost like 100 paisa.
But it is a drug.
It is the pre-stage of going to the process of addiction, because it is chewable tobacco. And as we know, tobacco itself, it is, kind of relaxant, and it will give you a sense of good mood, and you will feel that you are okay, just fine, everything is fine. So the chewable tobacco, which is afdal in Oman, actually, we don't know much about the ingredients, because it's not only the chewable tobacco, other things added. And really we need to have studies about this
particular
agent. This is afdal, because really we don't know what's the content of afdal, because it will...
And it's very, very common. You see a lot of youngsters chewing this
because
afdal.
They tried it and they were promised they will feel okay and relax, and it's really will give them the state of relaxed. And it's cheap, 100 paisa. It's affordable.
Yeah, anybody can afford it.
Yes. With time, with the use.
And it's legal.
Actually, it's not legal. It's illegal, but there is no strong restriction about afdal. And really, I do have my opinion about afdal, because from the cases that I come across in the clinic, so many mental cases, because of behavioral change, becoming more aggressive, changing personality because of the abusing. Even simple things like afdal. So afdal, one of the things,
so
which is
simple. It's a start.
It's at the start for the long journey of addiction. The second thing available and commonly used is morphine.
The medical morphine?
Yeah, medical morphine, but it's not from the hospital. Actually, it comes from imported outside illegal ways, for example, or black market or whatever source.
In what form does it come? Is it liquid or is it powder? How can you identify that this is morphine?
Actually, the common things that I came across and I just hear from our patients, it is in powder form.
Powder form?
Yeah, and a small pack, maybe not reaching half a gram. And it will cost like 10 riyal.
10 riyals, okay.
Yeah.
And you inhale it straight away, or do you have to mix it with water and drink it?
No, actually, different processes they are going through, morphine. Some people, they start with just sniffing the powder itself, and they are having even their body as a tool. They use the little finger, with they lengthen the nail, so that they call it spooning. They will make it like a spoon, just to make sure to take the whole amount, put it in a spoon, metal, and fire it from beneath with a little of salt so that it becomes soluble. And then they will take it like in a sponge, and I mean like in cotton, then they will inject it. This is the last stage. But the initial one is just sniffing the powder itself. So we talked about the morphine. It can be used as a simple way as sniffing as a start. With time, it will not be enough. So those who are expert in abusing the drugs, they will advise to inhale it. And with time, it's not enough because the nasal cavity become sensitive and no longer giving the fast effect. So they will advise to a dangerous route, which is injecting. The way that I explained to you, by the spoon, heating the spoon, and try to soak a cotton, which is actually the cigarette cotton, and they will use the injection to try to drain the whole liquid, and then they inject themselves. This is the common use of morphine. But those who are able to afford more, they go to heroin. Because the small pack, as I told you, half gram for morphine is 10 riyal. But for heroin, pure heroin is 50 riyal. So not everyone can able to get heroin immediately. So the most common is morphine.
Now, Dr. Amira, heroin comes in different forms as well, or it comes in a particular form?
Actually, it comes also in the same way. They are heating it with a spoon like a powder, and then it is used as a sniffing, the same process. Sniffing,
the same process.
If not, then they are preferring the injecting form because it's fast action, and they want the fast action.
Okay. So these are basically the common types of drugs in our society.
Yeah, just I want to add something is that with the drugs, they want also to feel other time in between they are relaxed. So they are using marijuana.
Yes.
As a smoking.
I was just about to ask you that. Is marijuana the same as hashish?
Actually, the term, it's the same. And even for us, if we ask our patients or what kind of other drug, they will mention immediately marijuana. And then I said, what? Marijuana? No, hashish. So they are referring to hashish. But really, I didn't see it myself. Only on the TV, just about hashish. It's like
a leaf.
Yeah, like a leaf, but it is processed and synthesized in a way that it become like smoking style. Smoking leaves. So
it is rolled.
Yeah, it's rolled.
It looks like a cigarette.
Yeah, it's looking like a cigarette, and they call it joint, by the way.
It's a very common term among youngsters. You hear this word joint many times.
And they are referring really to hashish.
Now, we advise our audience, especially parents, to visit special exhibitions which is run by the ROP that can educate you more in terms of finding out the types of drugs, to identify these types of drugs, so that at least when you see your kids possess this type of drugs, you would know immediately that this is a danger and you have to do something about it. Thank you so much, Dr. Amira, for sharing with us this valuable information. Now let us go to the next step, which is the effect of drug addiction. Of course, this can go in different forms, socially and religiously and community-wise and everything. So can you take us through this, Dr. Amira?
If we come to the impact, it's like a network, because it starts with the individual itself. Apart from experiencing the physical and emotional and behavioral changes, the person feels that himself is different from before. And he will experience guilt feeling because he is trying sometimes to stop. But it's difficult for him because of the pain that we refer to withdrawal symptoms, because of inability to sleep. So therefore, he cannot make it and he will come back to the drug. And this guilt feeling, with time, it builds up to become depressed and anxious most of the time. So the individual himself, he will go through anxiety. With advanced level, he become depressed. Even he will think to kill himself, to a level of suicide. So this is on behavioral aspect. Emotional aspect of the individual himself, he will feel that he's not of any value to anyone, especially if he's the superior in the family among other siblings. He will feel that he's a wrong model for others, and he's not appreciating his role, and this is why he try to escape or even to be away from the family, not to live with them.
Does it have to do with that when you become an addict, you don't have a way to go back to your original state?
Yeah, this
before becoming an addict.
Yeah, this we call abstinent stage. Abstinent stage, that the person tries in between to stop by himself. He's not encouraged enough to tell his family because they will blame him. Why you went through this?
Why you started in the first place?
Why you started? Why you put us in this situation? And blah blah blah. And he want just to cover the mistake by himself. He will try by himself to stop. He will experience the pain, and he will relapse, and he will come back. So this is what we call vicious cycle. And this is the individual level. That person will experience being depressed. He will even can go to severe mental disorders, for example, schizophrenia, bipolar mental disorder, even personality disorders, because he will change from the being kind, calm to more aggressive, not obeying the rules, trying to do things against the law if it's necessarily. So he will experience so many of problems as being an individual. On family level, the family as a start, they will feel embarrassed among others. And it's a stigma that if you have someone labeled to have like drug addict in the family,
yes,
it will affect the other members in the family. Because, for example, socially, if someone will get married, they will inquire, then it might not
you have a
proceed.
Drug addict in this family, and
exactly.
You don't want to be part of it.
Yeah, so it will affect the family setting. And they will not have good network with others, because other people, they have another view about them as having like a drug addict in the family.
Especially in Oman, the communities are very close to each other, and everybody knows the other family.
Yes.
And the culture, such a thing is not welcome into the culture.
So this is why it's very difficult to talk about it to others.
Yes.
This is why we are trying to enlighten the people that it is a mental problem. It is not something to be ashamed of. And alhamdulillah, medical service available as to the extent now, but we hope inshallah for more advanced levels of medical service. But at least there is alhamdulillah a way to start with, try to quit the problem. Another level is the occupational level. That person with time, because he's abusing the drug, he's not going to work, for example, frequent medical reports, escaping from the work, even stealing.
Inefficient. He's not going to be productive.
Exactly, and he will lose his job. On medical level, the person himself, he will go through many medical problems, especially HIV and hepatitis C, because of sharing the needles. They are not aware that the sharing of the needles, contaminated blood, it will transfer the virus.
And this is even more severe.
More severe, exactly. So
because you have a second headache on your list.
Yeah, you had the first, you want to get rid of the addiction problem.
Now you have HIV and hepatitis.
And you have a long chronic medical problem like HIV and hepatitis. It will lower your immunity. You will not be able to fight any simple diseases because of low immunity system. So this is regarding the medical aspect. Religious aspect, because of all emotional and behavioral changes, the person, he will feel that no longer having the right to be bounded.
The connection between him and Almighty Allah will disappear.
Lost. Exactly, because he's not in shape to
worship
his time, to pray. He will be tired to do. He's weak all the time. He's sleeping most of the time. He will not have the time to have like alerted state to just watch about himself in life and pray and ask God for a more successful life in his world.
And some of them will go to an extent that they will have a feeling that I have committed a severe sin and there is no hope.
Exactly. They will become hopeless.
And there is no mercy from Almighty Allah, and I'm just doomed. So there is no point for me to worship or do anything else.
Yeah. So this is a problem. Some people, they will take it in the other extreme. They will just go back. They will withdraw from their attachment to God because they feel that they don't worth to get the forgetfulness.
Now, drug addiction is a worldwide threat, and for sure there are some factors that contribute to the widespread of this disease. Can you take us through some of the factors that contribute in spreading drug addiction dramatically? As you mentioned in the beginning, you gave us the statistics.
We can make it in simple classification for the risk factors, starting with the individual himself. The person himself, he might have a mental problem. For example, there is many mental problems like conduct disorder or something called ADHD. In brief, it is hyperactivity attention deficit disorder, where these people, they are very active and they are having the tendency to go for abusing drugs to calm them, to make them relaxed, because they are anxious most of the time. They are very hyperactive. They want to be calm. So sometimes mental illnesses, it can pull the person himself to go for addiction. For example, as I told you, ADHD. They accounted like 40% they can go for such a problem. This is one aspect. Other aspect is that the person, he want to have his own world with others, and he want to become alone or involve in a gang or in a team. So he would like to do similar what others do, and he will go, for example, trying the drugs. This on an individual level. Second level, the peers themselves, surrounding peers, they will try to influence on those who are having weak personality or bullying them, try to put them in their team. They are challenging them that if you want to be a man, you have to be like us and use whatever we are using. Okay, this is another factor, the peers factor. Thirdly, the family. The family, if they are not watching out their children, what are their talents, what are their friends around, they are not caring for activities, no kind of any communication between the family and the children, a lot of conflicts like divorce, or even if there is other addicts in the family. And it will have a strong factor if there is like a father or uncle, whether a close or extended family member.
It can be an influence.
It can be an influence. So this another factor is the family.
And even overconfidence in our kids. Sometimes we overtrust our kids.
Exactly.
We pamper them so much. We give them allowances, maybe more than what they need. And when you have excess money and you don't know how to spend it, you'll try and explore new ways to spend the money. So
exactly. Sometimes it is, as you said, to the other extreme, overconfident. But even with the overconfident, they have to watch out what's going on.
Yeah.
Lastly is the community itself, the media, the technology, because really so many influences around in the movies, in the advertisements. It will influence them whenever they see, for example, a role model actors abusing drug. They will feel he's the one that I have to follow him or to be a symbol to him. So he will abuse drug. So many factors going around for abusing the drugs.
There is a thing that maybe some of the people are facing is that people are very comfortable in their lives and they feel that as long as this problem has not affected my family, then it's not my problem. I don't want to get involved. I don't want to know about drug addiction. I don't want to contribute in a campaign against drug awareness. But this is very wrong, because you never know when it can happen to you. And if you're not part of the community and if you're not doing something about it, one day it's going to come to you. Then what you're going to do?
Exactly. It's an unpredictable situation because you might be very trusting yourself and you're raising up system with your children, but you never know what factors can influence.
Yes.
So actually it is not an individual problem. We have to believe that we are all connected to it, and therefore we have to put our hand to raise awareness about the problem. Even if we are having healthy children at home, not necessarily to say we are safe, but other generations, even the neighbors nearby to you, they can affect you to some extent.
Now, the thing that we need to do is to see what is the role of the parents, the community, the school, the mosque. If you can tell us a bit about that, what can we do as a community to help in this? What is our role?
I thank you, Hatem, for really the nice question, because really it is a role that everyone forget. They are referring to the governmental part. This is to do with the government. They have to take care of. We have to start from ourselves.
Not everything the government is going to do.
Exactly. The family, first of all, have to watch out, supervise their children, have like communication skills with their children, interaction, appraise their children, having a reward system for their good performance, encourage their talent. Don't allow free time, because the boring
when they get
state,
bored, then
the boring state, it will push them to try something to busy themselves.
Yes.
And if the family, they don't take care of this all aspects, then there is a problem. Not to forget also to follow the school, how their children performs at school, if there is any academic failure, if there is frequent absence, even the look of the person, of the child or teenage, or we can say, for example, adult, if we wanted to make it in general. They have to sense the signs and symptoms that we talked earlier about and try to confront that person. You have a problem. Don't hide it. You have to admit there is a problem. Confront that person. There is a problem. We have to solve it. Otherwise, we'll lose you, or we'll lose the network in the family. So this is the role of the family. For the community, actually, all the aspects of media, whether magazines or radio as we do now, or TV, they have to highlight the problem, try to identify the seriousness about this problem by having, for example, interviews with several expert doctors about the problem, what are the side effects of the medication, or what the family do if they have children with chronic medical problem and they are using drugs. Such interaction about this subject, it will highlight the people to know more about the problem and try to contain it. And not also to forget the role of Royal Oman Police, try to have very strict laws about the availability of chewable tobacco, which is afdal, really, because it is the pre-stage, if we can name it, pre-stage to addiction, because it's affordable, it is cheap and
available.
So really, this aspect must be taken care of as well. Not to forget also the medical services. We have to have proper advanced medical service in terms of taking care of addicted patients. Because as we said earlier, addiction, it is not a problem of the individual because he's a victim and because it is a chronic mental disorder. And we have to take it from that aspect and not to blame or punish that person. We have to take his hand and try to provide a proper medical service.
Now, Dr. Amira, addicts that are cured, is there a possibility for them to go back to using drugs?
There is a possibility if we come back to the 5 factors we talked about: the individual himself, the surrounding friends, the family, for example, work environment or school environment, and lastly, the community. If there is any defect in either of these factors, then there is a problem, because he will relapse fast, because the person will be having a chance of weakness and he will take it. So we have to strengthen the 5 factors
so you should not
relapse.
give yourself an opportunity to go back to drug addiction.
Because if you are having good self-esteem, you have healthy, good friends around you, a good family and social network support, proper medical service, proper media awareness, and then you are at least in secure environment and you will try to be away from the drugs.
I remember a story of a young man who was a drug addict, and then he was cured, he went through a rehab, and after a few years he decided to go and give advice to his old friends and to advise them not to continue using drugs. And when he went there, basically he got affected and he went back to using drugs. And normally the experts in this field, they say that when you want to go and advise a group of people, do not go alone, because they'll always overcome you. Try and go in pairs or 3 or 4, at least go in a group so that at least you have a support and you will not get tempted to go back to what you originally were.
You are right, Hatim, because the recovered addicts, as we call them, the recovered addicts, they have the chance to relapse back. Therefore, they cannot advise others or guide others unless they are strong enough. So at least to be away from drugs, at least not less than 5 years. And then you will be ready enough, at least to some extent, to advise others. I hear so many people once they are just away like 1 month or 2 months, I am ready, I want to go back and help my friends. He's fragile. not yet having all the strong elements around him, like the family, himself, medical service, a community. Because still these recovered addicts still having a problem of joining back to the community. The stigma of the community to them is still not revealed. And therefore, this why not have the confidence just to go and advise others before yourself sure that you are able to be away from the drugs. Not only 1 month or 1 year even, at least 5 years. And still there is a chance if there is any break in the circle of network of support. And therefore I don't advise anyone. He says that I am 5 months away from drugs, I'm able to advise others. It's not a way because he can relapse fast and easily.
Dr. Amira, you are in the field of drug awareness and rehabilitation, and you support these drug addicts. Come across a group of drug addicts who refuse to seek help for certain reasons. What would you like to advise these groups?
First of all, we have to pass this small message is that when addicted person or anyone abusing drugs, having a thought to to clean himself, don't hesitate. Don't get afraid, because once you go to a medical service, they will provide the care because you are a patient. You are a victim of a mental problem. This is how we are looking to you. So there is no by any chance to call a police for you. And
maybe this is the main fear that they have.
Exactly. The main thing that they are afraid that if they will go to the hospital, we'll report back about them. And this is not true. So the first message is to provide the security to them that actually anyone seeks help, whether medical or through police, they are not quoted. If someone handed himself to the police stating that I know I am in this problem, I want to get rid and I want to stop,
they will support you.
They will support. They will arrange for you appointment in the hospital for that matter.
Some of them think that the police is the enemy.
Exactly.
But this is not true.
Exactly.
They are there to help you.
Exactly. The Royal Police, actually, as far as I saw, so many cases they are coming through the Royal Oman Police because some people, they are not aware that they are not quoted. They feel that if they will go and tell them that we are abusing drug, they will put him in jail. It's not true. They will study the case and really they will advise him to the medical service. But those who are caught dealing, it's another situation. For possession of drugs or whatever amount, and this is another case. It means
this is totally different.
But if you yourself introduce yourself to hospital or to Royal Oman Police, they will help you by providing you an appointment to get medical help. In the hospital level, for example, we are supposed to do our role. We'll try to assess the patient, find out since when he's in this problem, and this is a confidential thing. They are feeling that we are spreading his information around.
So the information will not be exposed.
Actually, the patient is interviewed alone, and then his family, because you want to have both sides of the story. And we are never telling each other about information said by other partner, because this is confidential. And this is important in the process of helping the patient. And then after the assessment of the patient, we'll decide whether the patient will go for cleaning system of 5 days in the hospital through admission, or given a treatment and to be seen in the clinic as an outpatient department every 2 weeks or every month, depending on the state. After 5 days of cleaning the system, we call it detox department, he will be moved to rehab sector.
I actually wanted to ask about this. We always hear about rehab process. What is it exactly, and is it beneficial?
Rehab process is to orient that person once he's free of pain, free of all withdrawal symptoms that we talked earlier. He's little bit ready to try to find out that there isn't a problem. So we are trying to make the person or the patient admit there isn't a problem and try to find all aspects of the problem of the patient. For example, if social, we are referring to social worker to take care of if there is any conflict in the family, any problems. If there is a problem at work, we are also taking care of that, trying to write to the assigned job sector that he's a patient and he's sick and he's seeking medical help. Try to strengthen the religious aspect, because this is the link, because they are having the feeling of being rejected, neglected, and they are worthless for any mercy or forgiveness.
So religion plays a big role.
Yes, and therefore we are trying to strengthen this aspect through setting of rehab center.
Okay.
Apart from that, having occupational therapy, some skills that it will help him outside. From that, also trying to strengthen the mental skills through having psychological assessment, raising self-esteem, try to understand your personality more, what's waiting for you in the future, how to manage if you relapsed back to drugs, what are the strategies to keep you away from the drugs. All these aspects are taken care of, and also to encourage the physical exercise to try to strengthen the body, and also to make the patient feel that if you neglect this aspect, you will go back to more of serious medical and also drug problem.
Dr. Amira, finally, 2 words of advice. One to the first group, which are drug addicts. What should they do when they find out that they are in this mess? What is the step for them to take? What do you encourage them to do? And the second group is the people who are not drug addicts, are normal people in the community. What is their role in general to help in this campaign of drug awareness?
For the first group of addicts, I advise them never say there is no cure. Never say there is no hope in my situation. Never hesitate to go for medical help. Even if there is limited resources, but it's not the end of the world, you have to try, because you want, your life is of value. And you have
precious,
and you have to take care of that aspect, and you have a family and you have a social network who would like to help you. So don't hesitate and go to medical service, and don't be afraid as well to report to the police that you want to get treatment. If you are not ready to go to the hospital but you don't want to be caught, don't hesitate, because they will not put you in jail. They will try to help you as much as possible.
Yes.
This is important 2 messages for the drug addicts. And those who are away from drugs, not having the overconfidence that they are cured enough within 2 years, for example, or 1 year, that they are ready to guide others. They're still in the fragile phase, and they have to wait, not to rush immediately and try to guide others, because they are having on and off missing for the drugs, and they are not ready yet to do it alone. And if they want to do it through proper channel, through, as you said, group of people going to advise or guide these people, or even to join like an associations, like for example Hayat associations. Try to get the skills,
be part of it,
and try to get the skills, and it will help you also to strengthen your
confidence,
your confident and your strong will that okay, I am in the right channel and right proper place. Don't do it alone, go for the proper place. And also the National Committee trying the level best really to advise every people, including those who are not addicted, about drugs, and try to make it not an individual case, it is a community case. For the second group who are not in the addiction, make sure that this is, to understand this is a big problem, and if not today, tomorrow, someone.
So we have to tackle it immediately.
Through becoming volunteers, raising awareness about this problem.
Even educating our kids,
watching kids, and try to contain them. The communication skills not to be lost. This is very important between the family and their children, the family and the society. And this is not an individual case, as I said, and they have to collaborate all together through all sectors, governmental or non-governmental.
Dr. Amira Abdul Muhsin Al Raidan, thank you so much for being with us. We have truly benefited from today's session, and I hope our audience as well have benefited and enjoyed today's session, and they have taken important notes through the pointers that you gave us. And I hope to see you again on our show, inshallah.
Inshallah, bidnillah ta'ala. It was nice interview, and I like it a lot, really, because it is a topic that we have to work hard to raise it out, because really the effect you will see it later. Now you don't sense it, but with the years, those who are neglected, really, they will suffer a lot of burden on the family, on themselves, and on the community.
Dear listeners, I'm your host Hatim Al-Absalam, signing off for today. Assalamu alaikum wa rahmatullahi wa barakatuh.
You have been listening to Reaching Out Through Dialogue.